The last remaining restriction on publicly funded abortion has been struck out. Clinics can now receive Medicare funding for surgical abortion, a big step for New Brunswick.
Today, our cabinet has repealed, let me get this right, paragraph A1 of Schedule 2 of the New Brunswick Regulation 8420 under the Medical Services Payment Act, and it has been confirmed by the Lieutenant Governor.
Susan Holt made it one of her first actions in government, but with surgical abortion only being done in 3 hospitals, she says the service is not yet accessible to all New Brunswickers.
We want to acknowledge that this does not change the fact that abortions will not become accessible tomorrow in New Brunswick. There is work to be done with the medical professionals and with the people in this room to make sure that we take this step and we move to get that access into community.
Holt took this step because New Brunswick had regulation that was specifically put in place to block clinic abortion. 30 years ago, former Liberal Premier Frank McKenna changed regulation to block Dr. Henry Morgenthaler from offering the service at a Fredericton clinic.
If Mr. Morgenthaler tries to open a clinic in the province of New Brunswick, he's going to get the fight of his life from us.
McKenna added a line to the Medical Services Payment Act to make it so abortions are only covered by Medicare if they're performed in a hospital and once the patient gets sign-off from 2 separate medical providers. In 2014, former Liberal Premier Brian Gallant removed the requirement for 2 doctors, but left the line that excludes clinic abortions from Medicare funding. Finally, almost exactly 30 years later, Holt removed that line altogether. The Canadian Civil Liberties Association has an active lawsuit against the province, alleging that that line is unconstitutional. The lawsuit has been active since 2021, but it's expected to be withdrawn.
I do know that the litigation cost the taxpayers quite a bit because, there was a lot of motions that the government put forward, the previous government put forward to try to stall and, they did a motion to strike. The discovery process was dragged on, mostly because of the government dragging the discovery process, so it definitely cost the taxpayers quite a bit of funds. But thankfully, we had a talented team of pro bono lawyers that did this work for CCLA on a pro bono basis.
The Premier and Health Minister both admit that removing a barrier is not the same as making the service more accessible. Holt says the clinics she promises to open in the coming years may be able to provide abortions. She says she's also open to expanding the service to more hospitals.